in yoga circles, people, including myself, use yoga nidra in different ways. So, you know, there's sort of like the classical practice of like moving through your koshas, and then, I mean, it's called yogic sleep because you're really trying to move towards sort of a disassociation from your koshas, so you can get to like your essential nature. But more importantly, like you're sort of more in a universal nature. So that's like kind of like the classic way yoga nidra was taught. It was used by some like famous gurus to get enlightened, like that process. And then what happened, I mean, I'm not an expert in this, but my understanding, just because I'm not a yoga history expert, but like my understanding is then people started using it in all different ways. And, you know, I was taught yoga nidras in that way. I was taught things people would call yoga nidra or prana nidra, you know, for different like koshas. Richard Miller's work, which is the IRA stuff, sort of has people in a relaxed state lying down. One of the things they do is, I mean, they do many things, we won't go into that, but one of the things they do is sort of look at opposites, you know, opposing things, so you can see that, you know, your relationship to those oppositional forces, and, you know, realize that you are sort of beyond that, separate from that, encompassing that. And then they have a lot of other techniques, but that's not what I'm talking about. But so there's a lot of different ways people do things. And then, so when you say like yoga nidra, should I use yoga nidra? What we have to do in this course anyway is, and by my mind, just like be more specific about our goals. So you can use yoga nidra in a few ways. One way it's commonly used is really what you would call shavasana, where it's like a anti-anxiety, nervous system, you know, tone technique, where you're lying down and you're teaching people how to breathe and how to have a little more witness consciousness, but not really what you call a real yoga nidra. You know what I mean? It's more like I'm taking a moment to feel my body, feel my breath, notice that I'm thinking, and separate myself out, you know, from that, so that it doesn't overwhelm me and my nervous system can chill out. We do that at the end of yoga classes, right, all the time. Therapeutically, so that's, I mean, that's a good practice, and you might use that as a yoga therapist, but that's what you're doing. So that's what you're focusing on. Can I get this person basically, you know, non-technically to calm down? And then you have other aspects that we might use where, you know, in that process that I just outlined, you could go much deeper into each part of it. So the body and how to like interact with the body, interact with the pranic body. How do I interact with the thoughts? How do I interact with the space beneath my thoughts? And so in any of those places, you could pause, you can enhance that experience, you can do techniques that kind of like rewire, like the pranic body, for instance. And, you know, people just generally call that yoga nidra, although you could call like the pranic one pranic nidra. I guess you could call something based on thoughts monomaya kosha nidra. I mean, you could have different names for it, but so just because it's lying down doesn't mean it's the same thing. The difference between that and say like meditation becomes like smaller as you start doing that, because you can do these things sitting up, lying down. I think the thing that defines yoga nidra is that you're kind of allowing yourself to be separate from or disconnected from or from most of yourself, most of the koshas. So the practice itself is about that. So that would be indicated when that was your goal. You know, when someone's too wrapped up in their identifications and they're trying to get out of that. That doesn't happen that often in yoga therapy situations. Not that it never happens, but usually in yoga therapy contexts, what we're doing is really trying to get like what we've been talking about a lot in this course, which is like balancing the koshas, getting in touch with the koshas, understanding the koshas, making the koshas flow more better, like removing obstacles from the koshas, but we're in them. We're not separate from them. So that is usually, like, at least in my experience, how I'm going about like educating or helping somebody in that context. And usually like a real solid, what you would call yoga nidra practice would be reserved for, it's a spiritual practice, right? To understand that, we'll say last in this context, like last part of yourself that's really not about you. Like, so it's not about you anymore. And, you know, people do that in meditative context too. It's just sort of a specific practice of like moving through the koshas so that you can shed them, right? So like my body is kind of dead to me. No, there's my energetic body, and now that's not relevant. I'm like, that's my mind, that's not relevant. So most disorders, right, are in those places, so they are relevant. So, you know, disassociating from them isn't going to get you anywhere. Now that could be argued, I'm sure, in some sort of extreme sports way. If you did yoga nidra perfectly, all your troubles would melt away because you're enlightened. But most of your clients are not going to be able to do that in a session with you. So you're still working on it that way. And so I think like if you think of those couple, 2 or 3 ways of thinking about it, that'll like sort of wrap our mind around it. And then just as an aside, I've talked about this before, but just because iRest is so popular and there's been so much study on the iRest systems in terms of yoga nidra, that's specific to them, in terms of, you know, the guy who started, Richard Miller, like definitely like is happy to play with the names of his programs and whatever. I mean, his goal, I've heard him say this, is really just to help people. And so if he's calling it yoga nidra, that's great. And you could always also call it meditation. You could also call it like PTSD, you know, whatever, management or whatever. But I wouldn't say, and just from my understanding, that like that system is like the definitive, you know, yoga nidra practice. So if you've studied that or see that, it's extremely useful stuff, but it's not necessarily the only thing people mean when they say yoga nidra. And all this is in service of the last thing I wanted to say, which is that you can't just prescribe yoga nidra. So when I've talked about it, I think I might have I might have confused some people, because I'll throw it out there like most people do and say, oh, give them a yoga nidra, you know, as part of this or that. But usually what I'm talking about is like the nervous system part, right? As a thing that you could give for lots and lots of conditions. What I don't mean is disassociating from the koshas. That is not indicated. In fact, for a lot of people with mental health conditions, that process is going to be very destabilizing. So a lot of times, yoga nidra would be a bad idea. I'll say mental health conditions, I'll also say trauma. There's a way to work with trauma within the yoga nidra context, but that's specific. Otherwise, it can really get to people in not a good way, and without follow-up and sort of clarity, you know, it can destabilize your clients.